morning, everyone. Welcome to my 3-month progress report. My PhD thesis title is The Relation Between the Maternal Factors and Birth Defects. Please let me introduce myself. My name is Zihan, and I'm a biostatistician and a full PhD student currently working in the Department of Obstetrics and Gynecology at Semmelweis University. My mission is to provide a closer maternity counseling to prevent the birth defects. And my vision is to increase the mother awareness and education and making fewer birth defects. Currently, I have 2 specific goals. The first one is investigating the association between the maternal risk factors and the cardiac birth defects, which started from September. And the second project is investigating association between the maternal medications and the cardiac birth defect, which is started from November. Both of them are the systematic review and meta-analysis. Okay, let's move to my first project, investigating the association between the maternal risk factors and cardiac birth defects. Congenital birth defects accounts for 1% of prevalence in newborn babies, which is the leading cause of the newborn death. According to the data from the European Registration and the Congenital Anomalies and Twins, for the severe newborns with congenital birth defects, only 40% of the mother will participate in the prenatal detections, and only around 20% of them to do it before 25 weeks of the gestation. It is worth noting that up to 30% of the congenital birth defects cases are associated with the maternal environment factors. So, we aim to identify the maternal risk factors and that are associated with the congenital birth defects. Our clinical question is, what maternal environment factors are associated with the risk of the congenital birth defects? We use a PECO framework to design our study. Our population are the pregnant women. Exposures are the maternal risk factors. The comparison is the absence of the risk factors, and outcomes are the congenital birth defects. We made a hypothesis here. Some maternal risk factors will increase the risk of the developing congenital birth defects. This project may contribute to the closer pregnancy follow-up through the maternity counseling. The systematic search was conducted on November 16th with the 3 major databases, PubMed, Embase, and Central. For the search key, I have divided into 3 domains. The first domain is the pregnancy mother and its synonyms. The second domain is the risk factor and the maternal exposures. The last domain is the general congenital birth defects and the most 10 common subtypes of the congenital birth defects, as shown in this search key. This slide shows the flowchart of the selection. We got 9,077 records from 3 databases. After the duplicate removal, we got 6,637 records, and then brought to the title and abstract screening. After the title and abstract screening and the resolving of the conflicts with RP, we got 265 records, and then they will put to the full text screening. The coherence kappa equals to the 0.82. That means there is a good agreement during the screening. This slide shows the progress of my first project. We are currently working in the full text screening, and we are going to finish it before the January. The second project is investigating the association between the maternal medications and the cardiac birth defects. This slide shows the most common maternal disease during the pregnancy in Hungary. For example, respiratory disease, cardiovascular problems, gastrointestinal disease, neurological problem, and some infections and inflammations, endocrine issues, and mental disorders, and some health problems specific to the pregnancy. To treat these common health problems, the most common medications taken by the Hungarian mothers during the pregnancy was shown in this table. We aim to investigate the association between the medications intake in the first trimester of the pregnancy and the congenital birth defects. Our clinical question is, what maternal medications are associated with the risk of the congenital birth defects? Compared to the first project, we changed the exposure and the comparison to the exposed to the specific maternal medications and no use of the specific maternal medications. The hypothesis is some medications during the pregnancy will increase the risk of developing the congenital birth defects. This project may provide the guidance to the healthcare providers on the medication management, risk counseling, and enhance the prenatal monitoring for the affected pregnant women. The preliminary research was conducted on the November 10th, and also we use the same three major databases: PubMed, NBase, and Central. Compared to the first project, we changed our second domain of the search key to the therapeutical exposure and medication intake and these synonyms to design our search key. In summary, there are two ongoing projects. The first one is investigating the association between the maternal risk factors and cardiac birth defects. It is a systematic review and meta-analysis, and we plan to finish it in the November of 2024. The second project is investigating the association between the marginal medications and the cardiac birth defects. It is also a systematic review and meta-analysis, and we plan to submit in September. Please allow me to end this presentation using my quote from Confucius, and it is also my research attitude. He was of an active nature and yet fond of learning, and he was not ashamed to ask and learn of his inferiors. Thank you for your time.
Congratulations on your great presentation. I would like to ask, what kind of risk factors are you going to examine, and are you planning to do a subgroup analysis depend on these?
Yes, actually, but we can't see any risk factors in my search kit because we want to avoid some public selection bias. So we are mainly focused on 7 risk factors. For example, smoking, alcohol, diabetes, obesity, undernutrition, and any other two other risk factors. So we aim to find these 7 risk factors, their association with the congenital birth defects. Yes.
Thank you for your presentation regarding for your first topic and the risk factors. So if nutrition is a risk factor, how will you measure it? What are you looking for? So how will you evaluate the nutrition of the patients, or
I think
with food recall or diary report, or
yes, in my screening process, so we include some articles related to the diet intake and some vitamin intake. So that should be the measure of the undernutrition. So also for the folic acid intakes before the pregnancy. That should be also also the factor we are looking for. Thank you.
Thank you, Zihan, for your presentation. I want to ask about your first topic. If you find any congenital heart defect, are you going to investigate if any other congenital anomalies occurs in the newborns?
Yes, that's a good question. So
thank you.
First of all, my PhD thesis title is the relation between the marginal factors and the birth defect. That means we include all the kind of the structural birth defects in our project. But in the meta-analysis, we mainly focus on the cardiac birth defect. But in the future work, we need to do the epidemiology research on the any other kinds of the birth defects using our very well organized databases in Hungary from Professor Achis. Thank you.
I have a question related to your second question. Do you have any expectation or hypothesis which drug can be associated with heart disease?
I think should be some some anti-inflammation drugs. For example, it's widely used during the pregnancy, and also some vitamins, because there is some misunderstanding of the vitamins. So the pregnancy mothers may take the vitamins and makes the
Yeah, but which vitamin?
I did the preliminary research and I looked through the vitamin A will make the higher risk on the congenital birth defects. Yeah, so yes, I think so, but I need to read more papers. Yes, to check any other vitamins or any other drugs, medications. Yeah, thank you.